Thank you very much, both. That was terrific. So let's find those markets to put in front of them. So I'm going to open it up for questions and comments from the floor. Yes, please.
Thank you for your presentation. My question is for Tiers about how do you measure the lives you impact in Africa, for example? I mean, I understood your dream, I understood how much money you put, but I didn't understand how do you measure it, you know, how do you say this is impacted or not? And the other question is, when did you begin to track it, you know? Because I saw that in 2017 there were 2.2 billion people, but when did you begin to track this? Thank you very much.
Thank you. I'm going to take a few. Let me take three, and then we'll answer. So I think Kathy.
Hi, thank you.
No, sorry, Joanna, I think was first, then Kathy.
Okay. One of my questions is Kenya is a very attractive market to many private sector companies that are trying to define healthcare engagement in Africa, and how do you make sure that you're coordinating or having healthy competition without having unproductive competition that creates confusion, I guess is what I would call it, for lack of a better term. That makes sense.
Great, next, and Kathy.
Hi. Yeah, my question is about those things that you can't really control. And the first thing that came to my mind was the availability of trained health workers. So, you know, as you gear up and provide these quality services and more of them in more places, is this in relation to some commitment by the government or other parts of society to provide more skilled workers?
Great. Thanks. Nduku? Let's do a response, and I'll take some more.
Thank you. So let me just start by saying that with regard to the coordination, that's an issue that has already started to emerge, particularly with the private sector. I think because of the previous mode of financing health, it has been development partners and NGOs, and we do have a mechanism. However, for the private sector, these conversations are actually happening now, and I know that the ministry is starting to look at an accountability framework and what that will look like. And secondly, the NAC was tasked to support the development of a data policy for health-related data. Because I think that's a big part of even our engagement with the private sector. What data can be collected, at what level, by who, what are they? So we have actually an expert team of legal folks doing that. And the final question around skilled health workers is that this currently, as we are talking, there is money, additional resources set aside in this financial year. We've had a huge increase in the allocation for the health sector in view of attaining the targets that have been set out. And in that additional allocation, I know that the KMTC has been given additional targets. The KMTC is the Medical Training College, additional targets related to healthcare worker training. But I think this issue goes beyond additional staff. It also goes to retooling the existing staff. And that's one of the areas where, as the ministry is talking about private-public partnerships, are beginning to say to what extent and how can the private sector support in the reorientation, particularly even as we do on two fronts. One is online-based training, but two, an accreditation system that strengthens or takes care of the impact of, monitors and tracks the impact of the training. Thank you.
Yeah, on the question on how we measure lives improved, it's basically based on the products that we sell. So each product has a certain, let's say, a certain indicator to it. And so based on the number of products we sell, we calculate that. If you're interested, it's on the Philips website. There is an explanation of how exactly that is being done. When did we start tracking? To be honest, I don't know exactly. but my guess would be somewhere 2011, 2012. Now maybe some of my colleagues in the room would know exactly when we started tracking. Maybe to the question about health workers. I think that is a very critical question. And typically when we talk to counties in Kenya or in other places, that is one of their key concerns. It's nice to have a nice health facility with solar and equipment and all that, but if there are no health workers, it's a white elephant. What we're going to do in this project that I briefly touched on in Makueni County is we are going to hire and train health workers. Initially, they will still be employed by the government, but they will be funded out of our business, let's say. And one thing I would say is what we have learned is that many health workers are frustrated from the fact that they cannot properly do their job because they're being posted to facilities that are non-functional. So our experience is if you put health workers into a properly functioning health facility, that will go a long way in attracting and retaining them.
Great, Tees. Thank you. Sir George?
Thanks very much. I think it's very fascinating. Let me express my difficulty, and perhaps you can help me. When you say that if you put a market in front of you, you will run, you're saying that the provision of healthcare is a market. We have learned that there has to be that invisible hand of the state in order for the market to function. I haven't heard from you, where does that hand of the state come in? And how does the state guarantee that the market does not go awry?
Thank you, George. And we heard a little bit yesterday from Sid around the platform and around that importance of public policy. Certainly has shifted a bit, but Tees, it would be very good to get your response to that.
Sure. Want to do it now?
Yeah. Sure, go ahead, Jen. Yeah.
Well, I was just going to echo what you had sort of started this set part of the session on, is that during the SDG conversation, it seemed very much like an understanding and assumption that the SDG goals couldn't get there just with government alone, that there needed to be these partnerships that would help us reach these, goals that we set out as member states, knowing they were very, very, very much laudable, but also very hard to reach. And so I think it's been interesting to hear how folks are sort of reacting to that call. Again, sort of from our conversation earlier, I think there's a need in the multilateral forum to remind folks of that part of the debate that happened a few years ago. And because when we're having these high-level meeting conversations, there seems to be less and less that willingness to collaborate with the private sector to reach these goals that we all had been part of this debate and conversation, just assume. Now it seems to be something that we have to force back into the conversation. So I think it's been great to hear these examples that we can sort of try to use and tout a little bit higher. But I agree that it's a very it's a provocative comment of to set a market out and to see the private sector run to it. And I think I would also like to hear what, as the public sector, can we do to help set that up.
Great, thanks. I'm going to hand back to Tees to respond. Madam, I'm going to take your question, but I'm going to do the Brazil conversation first, and then I will come back to you. But in the interest of time, I want us to move. So, Tees?
Okay. Yeah, thanks for that question, and I think it's a very valid question. I personally don't believe that that healthcare will completely be privatized. What I see in Africa is that private healthcare operators tend to focus to provide those services where they can make most money, which of course makes perfect sense from a business perspective. But those are not necessarily the same services that people need. So I do believe that there is a role for the government to play, either by offering those services as a government, as is currently mostly being done, or by ensuring that the private operators actually do provide the services that the government thinks are needed. And I think that is essentially what we try to do in this PPP. So we try to offer the services that the government wants to be offered, but we try to do it through more of a business model. And of course, Kenya is in a very interesting case because the national health insurance is now to be rolled out to 100% of the people, which creates a market because private, we've heard it before, private operators can also serve patients and be reimbursed by that national health insurance. So it's going to be interesting to see how the split between private and public health facilities is going to work out now that both of them have access to reimbursement from the national health insurance. So that I would say the jury's out there.
Great, thanks, Ethan.
So I will just speak on the question of insurance. For instance, we have a steering committee that's looking at the rollout of universal health coverage, and one of the indicators that is being measured at the steering committee level is the question of payouts for insurance disaggregated by private versus public, because we know it's very easy to end up becoming really privatized and NHIF paying all private. And currently we are just tracking that, but the discussions are already, should we be putting a cap to it, and what would inform putting such a cap to it. So there is a lot of should I say, control, particularly around issues of regulation, around issues of accreditation and standards, what private sector can and cannot do, matters related to procurement rules, matters related to public sector human resource engagement, because even if, for instance, Philips does add healthcare workers, they have to be aligned and operate within the PSC guidelines on human resource. They just can't walk in and say, now we have a new set of workers to run your hospital. And then there is the question of the accountability framework that I just talked about. So there is a lot of the discussions around the management of an engagement of the private sector have become very loud, as we have said, let's open up more to the private sector. So there is an agreement, yes, we must open up, but the conversations have now become really, really loud, and the questions around regulations have become significant.
Great, thanks, Nduku.